Hello and welcome to this UniTaster OnDemand event today, where we're going to be exploring university courses in cardiac physiology. My name is John Cheek. I'm the founder of UniTasterDays. It's my job to introduce the event and introduce our speaker. The speaker today is Natasha Watchorn, joining us from the University of Leeds. Natasha is a lecturer in cardiac physiology and is going to provide a guide to why you might want to study this subject area, what to expect on it, application tips and careers. And with that, Natasha, I'll pass things over to you.
Hi, John. Thank you for that introduction. As John said, I'm Natasha Watchorn and I'm a lecturer on the Cardiac Physiology Healthcare Science course here at the University of Leeds. I'm also the placement coordinator and the admissions tutor for the degree programme, as well as being clinically qualified and still practicing as a cardiac physiologist. In this short presentation, I'm going to provide you with the information regarding what is cardiac physiology and the role of a cardiac physiologist, what you should expect if you study cardiac physiology, some guidance on applying to university cardiac physiology courses, and finally, why you should consider a career in cardiac physiology. So to start with, what is cardiac physiology? Not many people have heard of cardiac physiology or know that it's a specialist profession within medicine and health. People actually think that we are nurses or doctors. In fact, we're more similar to a radiographer. We're dedicated to diagnosing patients with cardiac disorders. Our main role is in the diagnosis and assessment of individuals with either known or suspected heart disease. As a cardiac physiologist working clinically, you'd work with a team that comprised of professionals from different disciplines to assess, diagnose, and treat or manage a variety of patients with either known or suspected heart disease. However, our roles aren't fully comprised of cardiac patients. We see patients from a variety of departments and wards to assess the function of their hearts, valves, and investigate the effects of medication is having on their heart, for example. Cardiac physiology is predominantly an outpatient service, but we do also treat inpatients requiring tests. Due to the majority of our work being undertaken on outpatients, as such, cardiac physiologists typically work normal working hours, 9 until 5, with no shift work required, primarily being based in a hospital setting. Depending on the size of the hospital you work in, however, you may be required to work some weekends or take part in an on-call service. The tests that are performed by a cardiac physiologist form part of a larger picture in the patient's journey from the diagnosis of the disorder. We might only get to see a patient for a 10-minute ECG, but have to perform a relationship with this patient and gain their trust in this time. Cardiac physiologists work in both a non-invasive and an invasive setting. They'll start off learning the non-invasive tests, such as how to perform and interpret an ECG, which form basically the bread and butter of our jobs. They then expand to fitting and analysing heart and blood pressure monitors and working in exercise tests, before developing skills in the invasive cath lab setting, where they assist in angiograms and pacemakers and work part of a bigger team that includes doctors, nurses, and radiographers. The fast pace of cardiac physiology is particularly appealing to people, as it means no 2 days are the same and every heart is different, and you're constantly kept on your toes in a fast-changing environment. Here are some of the skills that are required to make a good cardiac physiologist. Skills such as intellect, commitment, and good people skills are really important, along with compassion, a sense of humour, and patience, along with being able, understanding, and able to multitasking on a day-to-day basis. But we also require communication, counselling, and practical skills. We work as part of a team and then use our scientific, technical, analytical, and problem-solving skills. So we've got a lot going on every day. Individuals often come to cardiac physiology because of their interest in the physical sciences, technology, and a desire to help people, but don't fancy being a nurse or a doctor. An understanding of the fundamental scientific background of the relevant field is important, including obviously cardiac anatomy and physiology. Pacemakers and implantable cardiac device technology is rapidly advancing, with patients receiving remote follow-ups with no need to attend hospital to see a cardiac physiologist in face-to-face. Therefore, the understanding of wireless technology is important. Cardiac physiology is typically taught within a research-rich medical or science-focused environment. For example, at Leeds, cardiac physiology sits within the School of Medicine. Now, cardiac physiology curriculum is taught by scientists and clinicians from different specialities and research areas. Patients and carers also form part of the teaching and are involved in all years of the course from admissions to graduation. A degree in cardiac physiology integrates physical sciences, technology, and clinical learning. Typically, in the early years of your training, you'll build up your knowledge of subjects such as anatomy and physiology, professionalism, and patient-centered care, and you'll learn about cardiac disorders and assessment. You'll also be taught how to form the tests required to successfully complete and collect the evidence for your clinical logbook. Most courses have first-year clinical placement that helps start putting your knowledge and skills into practice. Learning technology, such as online and realistic patient simulators, will be used to help you access and develop understanding of key information both on and off campus. The latter years of your university training will focus on developing and integrating your knowledge and developing your clinical skills with increasing time on clinical placements, so that by the time you graduate, you will feel confident to take on the roles and responsibilities of a newly qualified cardiac physiologist. Each cardiac physiology degree program is a little bit different and will differ slightly with different curriculum, but will be led to the same outcomes required by the National School of Healthcare Science and the Academy of Healthcare Science to ensure cardiac physiology graduates are competent and safe to practice. In this next session, I'll briefly provide you some information regarding applying to study cardiac physiology at university. In addition to the broad information I'm going to give you, there's plenty of additional resources out there to help you, including the NHS websites, professional body websites, and university guidance. Firstly, when you're considering a career in healthcare, it's worth exploring the types and nature of the work carried out by different medical health professionals. Cardiac physiology is a highly specialised area, and it's really important to understand what it is and what's involved, in addition to just testing patients and analysing their test results. Secondly, you'll need to consider where to apply. There's different types of cardiac physiology degree programs, and each course has a different academic requirements and structure. As well as a course, you'll also need to consider the overall institution and the location. And once you've narrowed down to where you think you might want to apply, you should review the website, find out more information, sign up for open days, webinars, and visit days to help you decide. And then once you've decided, you can put all that together in your application. This slide shows the tools that we have at our disposal to select our cardiac physiology students. All cardiac physiology courses use a similar process, as we have all the same tools to help us do this, but we weigh these differently to adopt our own school's ethos. At Leeds, the values of the NHS underpinned what we're looking for at assessment. Assessment of values is often achieved mainly through the interview process, either by reflection on past experience or by determining how a candidate themselves demonstrates awareness of effective behaviour in a work-related context. If your academic record is suitable, based on the entry criteria of the institution, or your UCAS form information is acceptable, you'll be invited to an interview. Here at Leeds, we follow the same interview process as our medical students and use a multiple mini interview format. Multiple mini interviews, or MMIs, have been done both face-to-face and more recently virtually due to COVID, and involve the candidate being asked a series of different questions by different interviewers. The types of questions you may get asked at interview are shown here, in addition to the appropriate academic achievement as indicated on your UCAS form. Communication, compassion, and caring are vital as such. And our admissions process has been developed to ensure we have a robust system to identify your motivation to be a cardiac physiologist and your understanding of the profession, and allows you to demonstrate your non-academic attributes. So, why consider a career in cardiac physiology? Undergraduate cardiac physiology is the start of a lifelong career of helping people and learning. No two patients are the same, and the range of roles, even on a day-to-day basis, results in cardiac physiology being incredibly varied. Employment prospects are excellent. There's a national shortage of cardiac physiologists, so it's pretty much guaranteed you're going to get a job. Once you graduate, you'll be eligible to apply for a Band 5 cardiac physiology post within the NHS with an approximate starting salary of £25,000 a year. With appropriate further training and development in the postgraduate areas of cardiac ultrasound and devices, depending upon your employer, cardiac physiologists can reach consultant level within the NHS. Some cardiac physiologists, such as myself, work in education and within a university setting where their job is primarily concerned with teaching and research. However, some work with paediatrics and some work within industry, supporting the cardiac physiologists in the clinical setting. So if you're interested in science, technology, medicine and health, and would like to help people and make a difference, perhaps you should consider cardiac physiology. More information regarding medicine and health professions, including cardiac physiology, the admissions processes can be found from various sources. Have a think, take a look, and make sure you ask some questions before making your decision.